I'm Ian Gilson. I'm a general internist. I came to the Froedtert and Medical College of Wisconsin clinic partially because they were involved in developing a medical home, a concept which I've always been in favor of, and I'm delighted to have been able to participate in along with my team as we deliver patient care. Well, my approach is an evidence-based approach, a scientific-based approach. I think things should be having some evidence of efficacy and safety behind them before we would want patients to do them. And that's why we are trying to keep up with the medical literature and medical textbooks and internet information on what is the right thing to do for patients. On the other hand, you can lay out the information, you can recommend medications, you can do prescriptions, you can send patients places for studies, and the patients have the right to question everything, and we have an obligation to provide a rationale for what we're recommending. I'm quite comfortable doing that. I really enjoy when patients ask questions and when they question our approach, because if we can't justify our approach, then we shouldn't be recommending it. I'm a general internist, so I take care of a broad spectrum of illnesses in adults. Ever since the mid-1980s, I've been interested in HIV and AIDS, so I have a niche in my practice where I have a group of those patients, many of whom I've been taking care of unbelievably since the 80s and early 90s. As far as my general medicine practice, I've had patients now for many, many years, and it is so gratifying to look back at that perspective of taking care of somebody for most of their life. I'm always learning as I go. As far as being part of an academic medical center, Froedtert and the Medical College of Wisconsin, it's the most rewarding job I've ever had because I'm working with such high quality people. It is uniformly high quality, and I know that my consultants are going to deliver. I know that my general medicine colleagues are going to cross-cover for me with high quality, and it just makes me feel good about the care I can deliver here. I also have gotten involved in some African work in the last 10 years, which has been very interesting. I go down to Kenya and Uganda and teach and mentor down there once a year, and that's been another interesting aspect of my career that probably never would have had if I never got involved in HIV.